Hi, I'm Michelle Walker. I'm a physical therapist and I own Proactive Therapy and Wellness. I help people with Parkinson's and other senior mobility issues to improve their movement and regain their confidence so that they can remain active and independent as long as possible. In this podcast, I'll be interviewing people in the community as well as clients themselves for their take on how they get empowered. Now, let's get on to the show. Welcome, Breanna, to the show. I'm so glad you could join us today. So let's just start off with you telling our viewers, our listeners, who you are, what you're doing, what are you up to these days?
Okay. Well, I've been a PT now, kind of crazy to think, 12 years. But I've had my own practice now. It's going to be like a little over 3.5, which is kind of nuts. I think COVID almost just like made time evaporate, I felt.
Yeah.
Yeah, but predominantly seeing geriatric wellness clients. Still see a little bit of concierge one-on-one private pay chronic pain clients. And I'm also doing a lot of like digital marketing and affiliate marketing programs, specifically targeting the senior population at this point. So yeah, but own my own practice. And I have an assistant that works with me who is amazing, who is actually my original boss. She hired me for my first job, and we worked at a skilled nursing facility together. She's amazing. We ended up being like one of the #1 rehab companies in the whole United States out of this little tiny town in Ohio. So yeah, she's absolutely fabulous
And now
and
she
taught
works
me
for
so
you.
much. Yes, now she works for me. And she was a PTA then as well, but like a lot of the skilled nursing facilities, they would hire assistants to run the departments, and then they would hire people. But yep, she hired me, and the rest is history, and she's fantastic and absolutely love working with her. So and now we're just working on growing stuff.
Typical client like? What's your
So typical client is normally anybody, like my youngest is 70 all the way up to 99 right now. So yes. So, and really my clientele are these individuals that are looking to be able to remain in home long-term safely for as long as possible, maintain a good quality of life, be able to interact with their family, continue to do the things that they want to do. So, and really avoid a skilled nursing placement, an assisted living placement if possible, and just maintain functionality.
So you see everybody in their own homes, yes?
Yep. I see everybody in their own homes. Now, I do have some clients that have transitioned to an assisted living facility. Like, for instance, like maybe the spouse has had more of a decline and just getting care in just hasn't been effective. So I have a husband and wife that are in assisted living, and I go see them there. So, yep.
Okay.
Yep.
And what kinds of things do you do with them?
So, because, obviously we're PTs, but I'm not treating a diagnosis. So like, for instance, a lot of my people have multiple comorbidities, so pretty complex comorbidities. So, like maybe we've had an old stroke, we have some dementia, we have a lot of diabetes, chronic pain, low vision, poor hearing, all of this stuff going on. And so essentially we're going in and we're creating a plan to facilitate them being able to continue to function with these complex issues and create an environment that is conducive to them continuing to be able to be active. So a lot of times it's like, hey, we're going to change adaptive equipment. We're going to change home layout. What type of a routine do you have in place now? And a lot of times there's no routine that's even in place. And the caregivers that are there might not even be a trained caregiver per se. Like they might not be a CNA or an STNA. They might just be literally a caregiver that's assisting. So it's not like there might not be a whole lot of skill there that they know how to manage these individuals with.
So you can assist them as well with modifying their homes so that they can stay home longer.
Yes.
Accessible.
Yes. Yeah. We're working on functional tasks. So literally it's like we're looking at the overall wellness and functionality of the individual, and we're just doing things to keep them moving, preventing falls. So, like I said, I'm not treating a diagnosis, but we're working on basic daily tasks to allow them to continue to do what they want to do and hopefully keep them at that baseline level for as long as possible.
Have you had any specific challenges? Like what do you find your clients, what are their biggest challenges recently?
Um, so getting good aid coverage can definitely be something that's really difficult because most of these people, most of my clientele are wealthy individuals that had the means to be able to stay home. But finding reliable care has really been a big thing for them. So like making sure somebody's going to be there at 7 a.m. to get them up and out of bed or ready for the day, or somebody's going to be there at night. Or the person that is staying overnight actually gets up when somebody is getting up. So I've had to do a lot of communication with some of these private duty aid companies that I work with to see what we can do to help improve that consistency of care, that quality of care, and just be like, what can I do to help? But that's really been the biggest challenge. I'm lucky my client, like my clients come looking for me most of the time. So they are already like totally open to doing whatever I want to do to help make changes happen. So they're not like, oh no, I'm not going to move this furniture, or no, we're not going to buy this piece of equipment, or no, I don't want to do these exercises. No, they're willing to make whatever happen. Yes, they are highly motivated and open really to whatever to keep them from falling, keep it from a cognitive decline. It's great. They're totally on board. So.
And because there are people out there who are not quite so motivated. We've all seen them.
Oh yeah.
So I know your clients mostly aren't that, but when you come across those, because sometimes the family members, right, will say, go work with my mom, even though the mom really doesn't want to work with us. But do you have any strategies or advice on how to motivate those people who just don't have it?
Oh yeah, definitely. Well, because even so, like with our dementia patients, that diagnosis drives the bus. So, if they're having a bad day, you got to modify yourself to what's going on with them on that bad day, and you change your approach. So a lot of times, like if one of my little ladies or gentlemen are like a little agitated or aggressive and really aren't necessarily like, hey, let's work out, I pretty much start the session with like just a nice little happy conversation. And I chat with them and I'm engaging them in things that they like to talk about. And I really have a true interest in what's going on with them. You build a relationship with them. And I'm normally like, hey, do you want to get a coffee? Why don't I make you a coffee? How about let's get some breakfast going or a snack. And then we sit and we chat a little bit. And then before you know it, that mood has changed and we've been able to redirect. And it's not like some difficult task. And I'm normally joking with them too. So it's like, hey, I'm making this fun. This is more of just like a social thing. And then it opens the door for them to pretty much do whatever I want them to do.
You wrap them around your little finger.
Essentially, you kind of do, but it's you build that rapport and you come in happy and nice, and you also give them space, but you use those tools. But that's the nice part about not taking insurance. I'm not stuck on like, I got to go get to my next 7 patients. I don't have time to deal with this. No. And like their family understands too. They're like, Breanna, I don't care if you sit there and talk to him for 30 minutes. And like he loves you, and he's super engaged with you and he'll get up and do things with you. So that's the great part, because socialization too and interaction is a huge part for that population as well.
Yeah.
So
do you ever see them or take them out of the house environment? I don't know, in a park or just even outside, gardening, anything like that?
Oh yeah, most definitely. So like, especially for like my high level clients who like have Parkinson's or like are frequent fallers, but are still very active, like want to be out in the community. I'm like, okay, let's see what are you doing every day? Where are we struggling? Let's go out and let's practice this. Yeah. For instance, I have a guy who's like a younger guy, well, 72, 73, but Parkinson's,
Yeah.
and very active outside doing stuff and keeps falling in the yard. I'm like, okay, let's go out here and see what we can start to do to just change this scenario, because we got to stop this. And then we will literally repetitively practice that thing until he's like, for real? I'm like, yes, I know. I'm gonna like throw this ball at you while you're picking up these sticks, and if you don't fall down, we're good. So, but yeah, and I said, I'm like, I want you to be able to do this with your eyes closed so that you have the tools to manage this when I am not here, and your wife doesn't have to worry. You don't have to worry. I'm like, I do not want to see you with a broken arm and then we get a setback for a year. So yeah, we'll do that stuff. I've gone to the golf course too with some clients. Yes. I had a client that literally could only stand for about 15 to 30 seconds when I first started seeing him. Yeah. Now I saw him for like 3 years. And then at the end was continuously exercising for 45 minutes to an hour, and now has since gotten better.
Oh, that's wonderful.
Yeah. So like I stood by and he was able to actually put the golf ball on the tee. Like we're talking somebody who could never bend down or do any of this stuff. And then, yep. So I was able to get in and out of the golf cart on his own and like played like 6 or 7 holes. Yeah.
How fun. I love that.
Oh yeah, like he's done and he's crying and his significant other is crying, and I'm just like, this is what it's all about.
Yes, exactly. This is why we do what we do.
Yeah.
Yes. Yeah. So what are some simple things, frequent but simple things you've advised people to do in their homes for safety wise? Things that you see a lot of and but are simple fixes.
Normally the biggest thing is layout and the stuff that is in the home. I just think we get so used to our standard living environment. Oh, I've always had the coffee table here, or the couch has always been here. I can't move this. This is just da 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 da. So normally my first thing is like changing the layout, getting like the little knickknacks or things that are on the floor, the decorative stuff that might be blocking a walkway when you're using a cane, the rugs, or if we cannot remove a rug, like I tape down the rugs. So although, like I said, I'm really lucky most people will do whatever because we've already had frequent issues. It's like, fine. But that's normally the biggest thing. It's the home layout changes. It's like, let's add some additional lighting. Let's get a grab bar in here. Let's get a bed cane in here. And like some of my people have done full blown home remodels where we did like a full walk-in shower. We got that little tiny shower out of there, put in a handicap height toilet, grab bars, all that stuff, and widen the doorway. So then they were able to use like their rollator into the bathroom. We're not just like grabbing walls to try and get in there. So
that's big. Widening doorways. That's a big.
Yes. Yeah. Yep. Widening doorways. But it's normally, so it's like grab bars, moving furniture, adding lighting typically tends to be some of the easiest, but the biggest changes for a lot of people.
It doesn't always take something big and expensive to make it safer, for sure.
No. And the easy part is like, here's a link to go buy it from Walmart, or here's a link to go get it from Amazon, and it's sent to your door, and here you go. And I'm like, and if you need me to help you put it on, we'll get it put on. So yeah. The installer of bed rails.
Yes. So you are currently practicing in 2 different locations, yes?
Well, so I actually have not started seeing clients in South Carolina.
Okay.
So yes. Yep. But I'm practicing in Ohio, but I split my time now between Ohio and South Carolina. So yes, I might start picking up clients. We'll see. I've definitely had some requests. So
yes. So that brings me to, if someone were in those areas and wanted to reach out to you, how would they do that?
Probably the easiest way is honestly shoot me a text message or give me a phone call. So yeah, 567-454-1046, and I can shoot you over all that info.
in the
Yeah.
description down there. So
Yep.
check out
Yep.
her
Or
info.
find me on any of the platforms. So I post a ton of videos
Yes, you
on,
do.
yes, on safety, on sequencing, like how to use a walker, how to use a cane, how to assist somebody getting out of a chair, car transfers, all that stuff. So I'm on TikTok, Facebook, LinkedIn, YouTube, IG. So yeah, pretty much all the major platforms.
Excellent.
You can typically
Yes,
find
and
me.
I can attest to those videos. They're great. So yeah, I encourage everyone to check those out. I will
Oh,
put
well,
those
thank
links
you.
down there so they can find you easily. Anything else you'd like to share with our group before we anything forgot?
I would say that, you know, I think for anybody who is like the caregiver of aging parents, or you are somebody who's starting to be like, you know, I need to make some changes in my life. I think the key that I try to always tell everyone is that one, age is a number. And regardless of where you're at, you can make some small changes that can truly transform your life. It's just start moving, start implementing some sort of a plan, create a daily routine for yourself. And it is amazing what the body can do in really not that long of a period of time. It's just like make a routine, stick to it. Even if there's simple changes, you will see a difference. And that long term will just have such positive like improvements for you. So yeah, make the changes. They will pay off tenfold long term.
And be consistent with them. Yes.
100%.
Definitely.
Yes.
Excellent. Well, I appreciate you chatting with us today, Breanna. It's been a pleasure.
Oh, well, thank you
I'm
for
sure they
having
picked up some
me.
tips and tricks from you. And we'll talk to you again.
Sounds fantastic. Thank you.